Okay, hi. We're going to talk about what is the difference between plant foods and animal foods. First of all, we'll talk primarily about plants. Plants have fibers. Every plant cell has fiber. Fiber is part of the individual cell's cell wall, and it's something that we don't absorb through digestion in humans, and it's a very important good thing. Fiber feeds good bacteria in your colon, and they make butyric acid, butyrate, 4-carbon fatty acid, carboxylic acid, that's a deprotonated form, butyrate. And that is used by the lining cells of the colon. The intestinal tract is called the enteric tract. So the lining cells of the colon are called the enterocytes. They use the butyrate to make tight junctions. The tight junctions keep the individual cells close together so nothing unwanted can get into the body from the intestinal tract. That's very important. Meat has no fiber, and because meat has no fiber, it allows sometimes leaky gut to occur. Leaky gut means that the cells, the enterocytes, are not tight together, and sometimes big chunks of protein plus bacterial side walls, lipopolysaccharide component, can get through and cause a tremendous amount of inflammation. In addition, antibodies can form to the abnormally large pieces of meat protein that get through, and those can cause autoimmune disease, a lot of bad autoimmune disease. So we're talking multiple sclerosis, lupus, and there's a whole bunch of other ones. Crohn's disease, ulcerative colitis, Sjogren's syndrome, Hashimoto's thyroiditis, it goes on and on. In addition, meat lacking fiber tends to make you constipated. Fiber helps add liquid, bulk water to the stool, makes it pass through the colon faster. With meat, the person tends to be constipated. A person who eats a lot of plant foods has nice soft poops like a cow patty. A person who eats a lot, primarily meat especially, and processed food and junk food, they will have a lot of constipation, and that's associated with increased risk of colon carcinoma. In addition, the stool in a meat eater tends to be dry on the right side of the colon, and sometimes it'll become rock-like and it'll obstruct the appendix, and then the glandular secretions continue below that until the appendix swells and bursts. That's appendicitis. Meat eaters have a lot more appendicitis than do plant eaters. And the increased straining at the stool and defecation of a meat eater with constipation, the stomach will very often pop up into the chest a little bit. That's called hiatal hernia. That's associated with gastroesophageal reflux disease, GERD, G-E-R-D, and that's associated with increased risk of esophageal carcinoma, not to mention the discomfort, the heartburn-like symptoms that are related to that. So that whole constellation of findings is called abdominal pressure syndrome, best described by Dennis Burke, and I got a whole lecture on that, abdominal pressure syndrome and fiber deficiency. So anyways, that's one big advantage that plants have over meat. Meat in its cell wall, every cell wall of an animal helps to stabilize its plasma membrane, individual cells, with cholesterol. So meat always has a significant amount of cholesterol, by definition. Plant cells don't have any cholesterol. The next thing is plant foods have a lot of antioxidants. Typical antioxidants, vitamin C. If you eat a plant-based diet, you usually end up about 80-10-10. 80% carbohydrate, 10% protein, 10% fat. And by the way, the healthiest populations in the world, they eat about this way. Next thing is, what is the best of the plant foods? Starch. Starch means complex carbohydrate. It means a plant food that contains essentially a polymer of glucose. That's an important point. We're talking about glucose. Glucose is good for you. Glucose is what every cell in your body wants. Photosynthesis goes this way to make glucose, and then human metabolism goes the other way to burn glucose. That's the optimal human metabolism. Polymer of glucose. And that's in comparison with fruits. Fruits contain fructose in general, and a little bit of fruits are fine. Also, if you're young and you're a marathon runner, long distance runner, you do triathlons, you got a high metabolism, great, eat lots of fruits. A lot of young guys are real healthy with that. And I think those Mastering Diabetes guys, Cyrus and Bobby, are really smart and really good, but they're young, okay? And you can get away with eating tons of fruit when you're young. When you're older, unless you're training a tremendous amount, you got to be careful of fruits that make you fat. I think that's nature's way of helping animals get fat. I also recommend avoiding nuts and seeds, except really minimal amounts, because they're atherogenic. Same thing with avocados, because they got a lot of fat. Same thing with oils. Don't ever eat oils. Oils are always bad. I don't care. There's no such thing as, I don't believe in good fats, by the way. I think that's sort of like a slogan that gets people to eat more junk food. I don't believe in Mediterranean diet either. What do you mean in the Mediterranean? Okay, that's just a way to confuse people, get them to eat meat and junk food. All right, now we're going to talk about meat. Meat contains primarily saturated fat and animal protein. They're both bad. Meat, you don't want to eat meat. The proper response of a middle-aged and older person when they hear the word meat is to be afraid, to move away from it, okay? If you're starving, yeah, sure, it's better than starving to death, but other than that, I wouldn't eat meat. Animal protein, it has increased methionine and cysteine. Those are sulfur-containing amino acids. They'll cause a lowering of the pH because during their metabolism, the sulfur gets pulled off. Some of it gets made into sulfuric acid, causing a metabolic acidosis. The body has to buffer that pH. It'll buffer that pH by taking calcium from the bone, perhaps a little bit also from the muscle. That calcium then is excreted through the kidney, so it causes calciuria, increased calcium in the urine. The increased calcium in the urine sometimes will precipitate and cause kidney stones. It can be really painful. My dad had a kidney stone. He was a tough guy. He was a boxing champion in the United Kingdom, okay? He said the worst pain he ever had in his life was having a kidney stone. It was like being kicked by a horse. Kidney failure. It's also plugging up the tubules in the kidney. You'll see, I've looked at many thousands of CAT scans with kidney stones, by the way, or of abdomens, many of them with kidney stones. And what you'll see is there'll be one big stone causing the patient's symptoms, but there'll be tons of calcifications plugging up the patient's tubules in their kidneys. And so it increases the rate at which they go into kidney failure, not to mention the atherosclerosis plugging up the origin artery of the kidney, the main renal artery from atherosclerosis. So you're simultaneously double screwing the kidney. You're actually triple screwing the kidney. You're plugging up its arterial supply, then you're plugging up its filtration tubules with calcifications, and on top of it, you're also causing hypertension, which is not good for the kidney, further damages the kidney tissue. You're increasing the risk of diabetes, further damages the kidney tissue. You're causing the kidneys to go into hyperfiltration mode because of all these excessive amounts of protein, which the kidney has to excrete the nitrogen. The next point is animal protein also has a lot of leucine. Leucine tends to be the rate-limiting step for activation of mTOR, which is a nutrient-sensing pathway, kind of like a contractor for building a building, and it's waits till it has all the parts available to start with building a building, let's say. And leucine, again, tends to be a rate-limiting factor such that there's a lot of leucine in meat, much more so than in plant foods. And what that does is it accelerates the rate at which the cells will progress towards replication and growth. And you don't want that when you're old. If you're a weightlifter, 20 years old, you want to get big faster. The meat will help you gain weight faster, but when you're after 40, you're scared of getting cancer. You don't want something to speed up cell replication, which also means speeding up aging. Hayflick limit is the maximum number of times a cell can divide, approximately 60 based on the work of Hayflick, a researcher with human fetal tissue cell cultures. We talk about that in other lectures. Okay, saturated fat. Saturated fat is bad, all right? All this stuff about saturated fat being okay for you, it's not true. You can feed people a high-fat meal, saturated fat, and those with coronary artery atherosclerosis angina will start getting angina attacks. And it is maximum at the time when the lipids are highest in their blood, which can be told by tests to measure that. Some of the good papers, Peter Kuo, KUO, wrote a nice paper about a 20% drop in oxygen pressure at peak lipemia. There's a paper by Rosenman and Friedman from the Journal of Circulation, 1964. They put an 80 times microscope to magnify the tiny little arterioles and capillaries in the eye. And what they found is that peak lipemia, these vessels would occlude. Okay, that's something to be scared of, arteries in your eye occluding, okay? That's part of the reason why over time a high meat intake associated with type 2 diabetes and hypertension is also associated with blindness. From plugging up the arteries in the eye. Meat tends to increase insulin-like growth factor, which tends to cause cell proliferation. The saturated fat is the number one thing that causes diabetes, intramyocellular lipid, and the insulin resistance in the skeletal muscle cells after eating postprandial increases insulin levels in the blood. Insulin is also anabolic, that's mitogenic, meaning to promote mitosis. So it increases the risk of cancer formation. You don't just have one way that meat increases your risk for cancer. It increases your risk for cancer in multiple ways. Increase insulin-like growth factor, increase leucine. And saturated fat itself causing mitochondrial dysfunction, that might play a role as well in increasing cancer risk. Here is rouleau formation. What that means is the saturated fat. The other thing too is you'll hear people saying, oh, there's no mechanism for saturated fat being harmful to the human body. That's not true. there's some very well-known mechanisms. One of them is that saturated fat causes mitochondrial dysfunction and increases insulin resistance. The best paper on that subject is the one written by Michael Brownlee. It's the Banting Lecture of 2004. You can check that paper at the American Diabetes Association website. And it's the best paper ever written on diabetes. I've read hundreds and hundreds of papers on diabetes. That's the best one ever written. Brownlee is a genius. He has type 1 diabetes himself, so he made a lot of effort to understand the disease, and he did. He deserves a Nobel Prize, that guy. Next thing about mechanism, saturated fat sticking the red blood cells together. That's because the LDL cholesterol overcomes the zeta potential RBC. So what that's all about is rouleau formation means stack of coins in French. And it causes the red blood cells to stack up and stick to each other. And the reason is the zeta potential is the glycocalyx of the RBCs, because there's a lot of sialic acid residues that are negatively charged, so that, let's say these are two RBCs, they repel each other because of the negative charges around them. But the LDL cholesterol will stick them together like a bridge. So the best paper on that is the work of Gregory Sloop, S-L-O-O-P, M-D, if you want to look it up, with regard to rouleau formation, how LDL causes increased aggregation of red blood cells. Best video on it, I like the video at Dr. McDougall's site, the one listed under blood sludge from one of his newsletters. You just type in high-fat meal blood sludge, and you'll get that video on Dr. McDougall's website. And he did that in his work with Roy Swank, the neurologist expert on multiple sclerosis. Okay, the next thing that sat fat does to red blood cells is it causes stiffening of the red blood cell plasma membrane, so it's less able to pass through a capillary. Red blood cells are about the same size as the capillary. They're both about 5 to 7 microns. You can have increased saturated fat in the plasma membrane causing interlocking of the fats. When fats are next to each other, they stiffen the plasma membrane. But it's also more than that. I think it's also glycation related to diabetic type physiology. And you can get advanced glycation end products, AGEs, that will then, you know how you get increased hemoglobin A1C in diabetics and with diabetic physiology and prediabetes? That makes the red blood cells stiffer. So it's harder for them to pass through the capillaries. The point being is when the blood is stiffer, the red blood cells are stiffer and the blood is thicker because they're sticking together, then your blood's like a milkshake instead of like water, and your heart has to pump at a higher pressure. So you get hypertension. Hypertension causes atherosclerosis. You get this whole negative cascade of events from eating meat. That's why I don't eat any meat. I won't take one bite of it because I want to stay healthy. Meat has a tendency to make people fat. The more fat you eat of any type, oil or from meat, tends to make you get fat. Being fat's associated with high blood pressure, hypertension, and all these things are associated with increased risk of myocardial infarction, increased risk of stroke. And by the way, anything associated with increased risk of hypertension and atherosclerosis is associated with increased risk of Alzheimer's disease. Diabetes, increased risk of Alzheimer's disease. So basically what I'm saying is increased meat intake makes you fat and stupid. It causes cognitive decline and it causes obesity. And now you'll see a lot of young people who can eat a significant amount of meat, but what happens is your body has a lot of reserve up until you're about 30. After that, you start losing your reserve, and if you don't get your act together in terms of nutrition, you just become like a typical person in this country, fat and sick. I mean, diabetics, there's millions of them. Every morning, it's like a river of fat diabetics flows into every hospital in this country. And there's a tremendous, it's like the most common thing. You don't even have to look at the chart quite often. I'll just know this person is an obese diabetic just by seeing how many strokes they have in their brain, for example. I look at a lot of brain MRIs. Also, you get increased heme iron. Heme iron's bad. You know, when a woman is of reproductive age, she's menstruating. She has a therapeutic phlebotomy every month. She's getting rid of some of that iron. But, you know, a guy or a postmenopausal woman, there's no good way to get rid of this excess iron. We're not made to eat meat, okay? We're just not, other than in tiny quantities. So when you're eating a lot of meat, you become eventually, over time, iron overloaded. And that can contribute to oxidative stress. It can even become autocatalytic if the iron gets separate from being liganded, let's say, to an enzyme. Douglas Kell, the PhD from England, has some really good lectures on that. His best paper on it is called Iron Behaving Badly. And it seems to be associated with one of the pathways leading to increased risk of Alzheimer's disease. In addition, the way your body works to prevent infections and reactivation of dormant bacteria is by sequestering iron. So when you got increased iron in the body and you become overloaded, eventually some of your cells start to fail and you get increased ferritin. That's the iron storage protein from your individual cells. The cell dies and undergoes necrosis. It gets into the blood, and you predispose yourself to all these oxidative stress reactions related to iron. You don't want excess iron. It's strongly associated with neurodegeneration in several different ways. Patients with increased iron deposition in the brain for whatever the other disease they have worse cognitive performance. So anyways, that is some of the differences there between plant foods and animal foods. And the big ones being that plants have fiber in every cell, meat has cholesterol in every cell, meat has no fiber, meat is basically fat, and animal protein. Plants are basically complex carbohydrate and fiber. So that's the key point. And starch is the best food. It's not only the best food for you, it's also cheap. Beans, rice, oatmeal, that stuff's cheap. Okay, so that's it for this one.